Folks, welcome to the meeting of the East Lothian IJB on today, the 30th of October. I'm going to hand over to Fiona, who's going to take us through the process side of things before we start the agenda. Fiona?
Thank you, Chair. This meeting is being held remotely and is being recorded and will be made available as a webcast in order to allow the public access to the democratic process in East Lothian. East Lothian Council and NHS Lothian are the data controllers under the Data Protection Act 2018, and data collected as part of the recording will be retained in accordance with the Council and the Health Board's policies on record retention. The webcast of this meeting will be publicly available on the website for up to 5 years. I'll now deal with apologies. I have apologies from Councillor Finlay, and Substitute Councillor Maguire is here today, and also apologies from Marilyn McNeil. Are there any other apologies that members are aware of? No, thank you. I'll now move on to the roll call of attendees. Shameen Akhtar.
Present.
Liz Allen. Liz?
Fiona, I think she's just logged on.
Yeah, I can see her in the list. George Thanks, Liz. George Maguire.
Present.
Thank you. Carol McFarlane.
Present.
Jonathan Blaseby.
Present.
Patricia Cantley.
Present.
Andrew Cogan.
Present.
Elizabeth Gordon.
Present.
Maureen Allen.
Present.
Thank you. David Binney.
Present, thank you.
Darren Bradley.
Present.
Thanks. Lindsay Byrne. Oh. Sarah Gosner.
Present.
John Hardman.
Present.
Thank you. David Hood.
Present.
Kalondi Cassingelli.
Present, thanks.
Claire MacDonald. Claire McIntosh. Liam Kerr. Mike Porteous.
Fiona, Mike is coming. He's locked out his laptop, so he will be joining. He's just sent a message. He assures me he'll be here for the finance paper.
Thanks, Fiona. And just confirming Fiona Wilson's attending as well.
Present.
So that's us done the roll call. Do any members have any declarations of interest to make? No. Thank you very much. That's us ready to start the business, Chair.
Thanks, Fiona. Okay, we'll move on to agenda item 1, which is the minutes of our meeting from the 25th of September. Any minor typos or issues like that, please pick up with Fiona. We'll just have a quick whiz through page by page, and if there's any matters arising from that that people wish to pick up, then please shout out. So I'm on page 1 to start with. I'm now on page 2. I'm now on page 3. I'm now on page 4. Page 5. Shameen.
Yeah, thanks, Andrew. I've lost track of which page it's on, but we had a really helpful presentation from MELDAP. Mr. Bonner provided us a really kind of helpful update of his report to Scottish Government. And because we've seen drug-related deaths year on year go up in East Lothian, my understanding was that we did talked about the possibility of doing a development session of just better understanding behind that, which didn't give us a lot of time to do at the last IJB, but just to better understand what was happening within East Lothian and other ways that we can support him in his role.
I completely support that, Shameen. I think we just build that into the programme for future development sessions if it wasn't already done so. So thank you for raising that. I'm continuing on to page 6 and finally page 7. I'm seeing no more hands. We have a number of items on the action log. There are 3 then that are recommended for closure, and we've covered these before. There's one there around the care at home strategy, and Laura, I think it was we will bring an update to a future IJB either at 6 months or in the normal reporting cycle. I'm assuming that can be then, once the date's agreed, that can go into the action log. Is that correct, Laura?
Yeah,
I see you
right.
nodding, so.
Yep, thanks.
Yeah. Okay, just a quick pause for a moment. Any further issues from the last minutes and the matters arising? I'm seeing no hands, so thank you, colleagues, for that. We move on to agenda item 3, which is a very brief chair's report in that I was going to report on the partners meeting that we held, but unfortunately that was cancelled due to quite a number of people being on half-term holidays. So once we have our rearranged partners meeting, I can give some feedback to colleagues on that. And there haven't been any IJB chair or vice chair network meetings that I've attended or that have been held over the last 4 weeks. So nothing particular for me to feedback. I don't know, Shamim, if anything you've picked up as vice chair and things over that period.
Just to pick up from the last meeting, the last chairs and vice chairs focused on housing and technology, and I forwarded on the information around that, and how government can make better connections between health and housing was quite a strong emphasis of that event. And just to highlight, yesterday was the Carers of East Lothian annual general meeting, with Jenny White as our new chief executive. So we had a really productive AGM, just highlighting the valuable contribution that Carers of East Lothian have been playing to carers across the county, and particularly the people centre services, and what a difference it was making to them. And they also had a session around how they move forward and looking at other potential services or support that they could provide carers. But it was really productive, and it was really inspiring to see the difference that they're making to carers across the county. So just to thank them for that.
Great, thank you for that, Shamim. John?
Oh, just from that, Shameen, yeah, was there anything further, remember we discussion we had at the development meeting around the changes to the Carers Act, or I don't know if there was anything that came up in relation to those discussions we had at that meeting?
Yeah, nothing came up at that meeting, but which has just reminded me, there was a convention of Scottish local authorities, and that's where I did raise the break for carers. And as you remember from our development session, that will be legislation. So we put across as forcefully as possible that we welcome the break for carers, because that's such a vital, important part of supporting them, but we have to make sure that they're funded appropriately, and that we're really clear about the level of funding that we've received and the expectation that we can make. But we were really supportive of the premise behind that, but we need to get the appropriate level of support to be able to deliver that for carers, because we want to raise the expectation and be able to meet that expectation, but not raise it and then not be able to meet it. So I did raise that. Thank you.
Laura, do you want to come in? Is something to add on that?
Yeah, it was just I'll take David Binney's thunder here. So we had the programme board for carers yesterday. I think no update on legislation, but the lead is actively working to be in front, so knows exactly what's coming, when it's coming, is engaged in the consultations that the government are carrying out. Shameen's absolutely right with her points. I think what I'm pleased with, and I think recognised yesterday at the board, is just what a proactive and interactive board the Carers Programme Board is. It's very engaged, it has great feedback, and they make some difficult decisions about funding and where we should allocate that funding, and works well with the Young Carers organisation that's run through the council. So yeah, just a reminder of that and a kind of big up from the Carers Programme Board.
Great, thank you all for that. So I'm seeing no further hands, so we'll move on to the substantive items on the agenda, and the first one being the East Lothian Integration Joint Board Members Code of Conduct. I don't know if Hayley's here or whether it's Fiona who's going to take us through this.
I am here.
Sorry, Hayley, you weren't on my screen. Apologies.
Thank you so much. I'm happy to run through this. I'm sure it's everyone's favourite report of the year. As you mentioned, this is an update of the IJB code, and it has This is essentially the annual reminder for members around their personal responsibilities in relation to the Code of Conduct. Briefly, as members will be aware, all IJBs must have a Code of Conduct in place, and the Lothian IJB has had a code in place since 2015, updated substantively in 2022 to align with the changed model code from the Standards Commission. The updated code today just has two minor administrative drafting updates, one to reflect the change of standards officer, so myself taking over that, approved by the IJB back in March from Fiona, so minor name changes on that. And the second is in relation to the removal of the collective responsibility provision, which was an administrative error. That is a standard clause within the model Standards Commission document, but it's not applicable in an IJB setting. So we've the draft version removes that just to resolve that administrative error. As I mentioned, this report also acts as a reminder for members around their responsibilities in the code, and I've shared a slide pack for members to peruse at your leisure. I'm not planning to go through each slide, but I would encourage you all just to remind yourselves of the key provisions. I'll briefly highlight a couple of points that do normally come up with me, but I am available at any point, and I'll pop my email address just in the chat, so you do have that direct contact. I'm also more than happy to do a specific development session if it would be helpful for the IJB, and as I say, always happy to take individual please. Very, very briefly, the code is based around the 9 principles of public life that I'm sure you're all very aware of, and it is each member's personal responsibility to ensure compliance with the code. A key question that I'm always asked is when does the code apply? So the code does apply, you know, kind of obviously when you're acting as an IJB member, so in formal settings like this. If you ever identify yourself as an IJB member, the code comes into play. And also if you could reasonably be regarded as acting as a member, which does include in social media. So for example, on your social media profile, if you do have IJB member and then you're making commentary in relation to the IJB, a reasonable person would expect that you be acting as an IJB member in that place. So I guess just a word of caution around kind of social media, etc. We are seeing through the Standards Commission far more cases in relation to commentary, either on social media or online in general. So always something to be mindful of. The code doesn't intend to prevent you expressing views, particularly in an IJB setting where actually people are brought together for their specific views, but you do have to do that based within the provisions of the code. I'll quickly just run through a couple of sections, and then, as I said, more than happy to take any specific questions. Section 3 is the first substantive section of the code, and that's around general conduct. The key provisions are around respect and courtesy, and in relation to interactions with both your board members, officers, and members of the public. The revised code that was brought in 2022 does really strengthen the provisions around bullying and harassment, confidentiality, and gifts within this section. So two key points just to flag in relation to confidentiality. Members should ensure that they have explicit consent to share any information that they receive as a board member. The code, which is a big change from the previous code, does specifically say unless you have that express consent, you should assume that the information is confidential. So again, just something to be aware of for members. And gifts and hospitality, quite simply, it simply says you shouldn't accept anything. I'm not sure as IJB members, if you ever get offered a lot, I'm sure it's not something that's that appropriate, but other than a kind of keyring pen at an event, you should be saying no to any gifts or hospitality.
I can see some smiles around the screen as you said that.
I know, I'm yet to hear an example of a big gift offered to an IJB member, but I'm sure it may come up at some point. Section 4 covers registration of interest. I'm not going to cover that in any detail today because every member does have their register of interest. But again, if there's individual requests on that, because you are required to do that, then do please get in touch. Section 5 was one that I did want to briefly cover today, and that's around declarations of interest. And this was a real substantive change from the previous code for those that did follow the previous code. As you have done today, members are formally asked to declare any interest within the formal meeting setting, and I think everyone's very used to that and aware of that. But you must also consider if you have any declarations in less formal settings, so within subgroups of the IJB, and even when you're discussing matters with an officer, if there is something that you do feel is a declaration, then please do make that known at the time. So again, just an awareness of that out with the formal meeting is probably the message there. Declarations have a 3-stage process. And it is relatively simple and again much more simple than the previous code. And the 3 sections are connection, interest, and participation. So a connection is essentially anything that you can have that you are interested in. And as mentioned, I guess the beauty of an IJB is that there's a lot of people on the board who are in that place because of the connection that they do have, and that's quite unique compared to some of the other public bodies. So having a connection itself doesn't prevent you from participating, but you may want to on occasion make a transparency statement around that. And again, happy to speak to any members that do feel they may fall into that category. Again, you can continue in the debate, but the transparency statement would be recorded in the minutes. The second process is to make that assessment. If it is an interest and you do need to make that declaration, then you have to make you simply apply the objective test for yourself, and I will read this as it's a relatively simple test, and you need to consider whether a member of the public with all the knowledge and relevant facts that you have would reasonably regard your connection to a particular matter as so significant that it would influence your decision making. So that's not someone who doesn't have all the facts, someone that's very removed. It's someone who that knows everything that you know, and obviously only you can make that assessment. But again, happy to provide advice on that if you ever are in that situation, and I can also kind of share some of the live cases that have gone through the Standards Commission, because there's generally something that's relatively similar. So please do reach out. If you do make that assessment that you do have a declaration, then you do need to remove yourself from the meeting. And if it's an online meeting such as this meeting, that's fully leaving the meeting. And Fiona, as the clerk, will call you back in. It's not enough, and the guidance is quite clear to put your camera off or mute yourself. So it's a full removal from the meeting. Section 6 is a short section on lobbying and access, which is relatively self-explanatory and again possibly less relevant to an IJB than on other boards, but again happy to pick that up in a wider development session. So those were the key points that I was keen just to remind members, but happy to take any questions.
Thank you very much, Hayley. I will open it up for a few minutes for any comments, thoughts, observations. John, first.
Yeah, thanks, Hayley. Yeah, I think obviously there's very minor changes to the code, so obviously no problems with that. My question is around sort of belt and braces governance in terms of us as IJB members, whether we should be confirming that we've read the code and understand it and will comply with it, or either at the start of the year or the end of the year. I know we did a register of interest, and just whether there is just to make sure, I say we don't do any online training, but you might do other organizations around codes, ethical conduct, etc. So I just wonder, without adding to paperwork and bureaucracy, whether we should, just as the paperwork, to have signed something to say we've read it. I mean, I know we're missing, say, people here today, so they may not have, read this. So I don't know what you think, Andrew, as chair there, whether that's something we should bring in. Fiona, Hayley, I don't know. I'm just raising it.
Hayley, your thoughts on that? I know we've said for those of us who are members of NHS Lothian charity trustees, we will sign something there. So I don't think it's uncommon for this to happen. I don't know if you have any thoughts.
Yeah, so it's not a requirement. There's nothing around the code that says, you know, all members should sign that. It's around personal responsibility. So I think absolutely, if you want to add that to your governance, I think that's a helpful check. It's not a requirement. I think for me, personally, and maybe someone who really likes the code, so I maybe would say this, that I would rather we built in a formal training session and we kind of confirm you have a record of who's attended a training session rather than a simple read of the code. That's my personal view, but I'm happy to be guided by you, Andrew.
Fiona, do you want to come into that before I offer a response?
Yeah, it was just to confirm that we have been asking members since I think 2022 there was significant change to the code. We've been asking members to sign the final page of the code when they join the IJB.
Okay.
And there will also be a register of interest update coming out shortly, and anyone who hasn't signed, I'll do a catch up with them as well to get their signatures.
I just think having an annual update, I think, is no bad thing. If this does go wrong and someone turns around and says, okay, IJB members, where's the proof that you guys actually looked at this, that you knew what it was? Oh, look, there was a bunch of changes since 2022 or whenever you joined. You know, how have you evidenced that? I think I would definitely believe we should do something annually, but and I think that idea of training actually is a really good idea, but
I don't disagree with any of that, and I think we've got it covered, but I would see no problem at all to build a half-hour, 40-minute session into one of our development sessions for that training, and then we can make a note of it as well as the more formal thing. So I look to Fiona and colleagues to build that into the programme. And if you're going to say anything completely different, Fiona, then speak now.
No, definitely not going to say anything different. I think it's just highlighting the reason we introduced it was just that level of assurance of having it at an IJB meeting, because our concern was how do we just ensure that we have and our responsibility around delivering it. So that's why, Hayley, you've kindly taken over from me and then just delivering it annually, because for that very point, Jonathan, that we were concerned that there might be an opportunity for somebody to say, well, no, I don't know about it. We actually have it. So we can absolutely build more in, but a huge thanks to Hayley for taking this on. But again, just that's the background for those who've not been on, that we introduced this annually for exactly that point.
Thank you. So I think for the action log, we just note that we will look to have, as part of a development session, an annual update where we note it, as well as the paper that comes. We'll have and we look forward to. I'm assuming it will be Hayley who delivered that session for us. That I think will be very helpful. Okay, we have two formal recommendations. One is to agree the amended code of conduct. Those were the changes that Hayley identified, and I don't think we have any objections to that because that's in line with new policies. And then to note that each member's personal responsibility to comply with the code, etc. So I don't think we need a vote on this. I'm assuming all members are fully in agreement with those two recommendations. I'm seeing no objections to that, so thank you, colleagues, and thank you, Hayley. I know it was quickly through that, but I think that slightly longer session will be of value to us all. So thank you very much for that.
Thank you so much.
Okay, we move on to agenda item kind of 5 and then 6, which is going to hand over to Sarah, who's going to take us through the clinical governance side of things. So Sarah, first for agenda item 5.
Thank you, Andrew. So everyone should have the paper available to them. The ask is that the IJB note the content of my report around the Partnership Clinical and Care Governance Committee. So the background to this is the efficiency and impact of the Clinical Care Governance Committee within our service and wider was measured as part of an overall clinical risk and governance review back in 2023. And as part of the action plan from that review, we set up a short life working group to have a look at the structure of our governance committee. Was it delivering what we wanted it to deliver? And as part of the review, it was identified that probably the wider workforce didn't have the recognition or the understanding around what governance meant to them and their role in clinical governance within the partnership. One of the first things we did as part of that short life working group was we asked each of our teams to go away and map what their governance structure looks like. And there's an outline in that in the appendix included in the paper. And I think what that showed us, we have clinical governance covers a huge amount of our meetings, but it was how do we make sure that we know how they're all reporting into each other and the information that is being reported through those structures. So that was a very worthwhile sort of housekeeping exercise. When we then turn to have a look at our reporting structure into our committee, what we decided to do was that our reporting structure was to mirror the NHS Lothian Healthcare Governance Committee reporting structure, which was providing assurance on safe, effective and person-centred care. We have got some ongoing work as well, looking at the data that we use to provide that assurance, and that is ongoing work. One of the things that we've put in place is we have adjusted the frequency of meetings, so we have more frequent meetings than we did. Previously at our meetings, we would have every service reporting in, and they were quite lengthy meetings, and we probably weren't focusing on some of the data that we had in enough detail. So this morning we've had the first of our new structure of meetings, and some of the officers on screen presented their services today, and that really enabled us to have a real deep dive in some of their data, looking at the assurance, asking each service the assurance that they were providing, and it felt like it worked well. So that is sort of part of our ongoing improvement. We've asked for feedback around that structure and to see how we move forward with that. One of the things we're focusing on as well is actually having a look at what policies we need to bring to the committee for sign off and how we sign those off. I mentioned about the wider staff engagement and awareness. One of the improvements that's happened over the last 12 months is each of our services now have their own local governance meetings, where they bring their band 8s and 7s together to have a look at key governance issues, review their DATEX's complaints, review their data. And that was really apparent to me on this morning's meeting, how well that is working and how we're really triangulating that data and bringing that together to, as I say, to show our assurance around the services. One thing we're very aware of, though, is how beyond that sort of team lead level, how are we making sure that staff across all of our services are aware around their role that they play around providing assurance through clinical governance, and making sure that they have that knowledge. So I met with Jen Jarvis from a comms perspective a couple of weeks ago, and we're planning to launch a sort of campaign probably in springtime, really focusing on making sure staff have that awareness, but actually listening to feedback from staff around what information they would like to help them with that understanding. With regards to engagement, how do we engage with our service users? We very much use patient stories, we use our complaints, we use our patient feedback. And if as part of our governance process that we need to engage with particular groups, then we'll use that through the committee as well. So I think that's probably my summary for the paper. I'm happy to answer any questions. I think for me, there is still some improvement around our clinical governance committee. It is ongoing, but it does feel that we have made great progress over the last 12 months. And it's a really good committee for us to be able to provide assurance to the IJB.
Thanks, Sarah. Just for members, I probably slightly confused it by moving to agenda item 6, and we've skipped number 5. So Sarah has spoken here to agenda item 6 that starts on page 112. We'll go baback to the healthcare governance report afterwards. So
apologies, Andrew, that was me.
Don't worry. I mean, so that, if people haven't quite caught up with the pages yet, so we're on agenda item 6 here. Sarah's been through that paper, so I'm going to open it up for any comments, observations, thoughts from colleagues. And I don't know if John wants to add anything before, or will contribute as part of the conversation.
Yeah, no, nothing to add, Andrew. I think that was a very full summary from Sarah, and I agree with everything she has said. Thank you.
John.
Yeah, thanks, Sarah. Just sort of short life working group. Does this paper mean that work is now complete? I wasn't really sure from the paper whether that's the case, and I'm still not quite sure if the paper sets out what those, I don't know, maybe I misunderstand and when I'm reading what those key areas of focus were when it was set up. I mean, this is more at the sort of read as though this was a bit of an interim paper, but maybe I misunderstand. Thanks.
Yeah, Jonathan, thank you. So I think for me, the paper has just outlined the work that we have done and just providing that assurance around what we are doing around the committee. So the short life working group is still exists. As I say, what we have done, our main focus has been changing the structure of the meetings and making sure that how we're focusing on the data, how we're doing a deep dive into each of the services. So we had that first change of meeting this morning. So the short life working group will come together just to assess, just to get feedback from that meeting. And then the proposal for the short life working group is to continue until we do the engagement event in the spring. And then once that has been achieved, I would look to closing that short life working group.
Okay, thanks. And I think we'll come back to this question probably on the first report, which is section item 4. Is the question just broadly about our role as an IJB on clinical governance? And I'm not quite sure what our role is here. And that might sound a strange question given it's IJB, but I'm not sure I'm really clear in terms of what we should be doing as an IJB in this area. I mean, this is just for noting. I know, you know, lawyers go through healthcare governance itself at NHS level. So I just wonder if you're possible, if you just clarify, at least for me, kind of how this sits for us and what we should be doing or thinking about.
John, did you want to come in on that one, or was it something else? Or
it was the kind of previous point. So maybe
go to that previous point, then we'll have a go at, because I don't think it's just a question for Sarah and John around IJB's role in terms of clinical governance. I think it's a question for us all.
It was as much as anything just to expand a little bit on what Sarah said before about the function of the short life working group, which is not completely completed its work yet, and it's looked at the overall strategy and the function of the meetings, but we're also looking at mapping all of the different groups across the HSCP, including hosted services, and making sure that we've got a good understanding of how they all report into each other, and making sure that all those processes link up together and escalate appropriately, which hasn't been the case completely up until now. There have been a few loose ends, so I think we're still working through that process to some degree, but I've made some good progress there. Thanks.
So then we come back, Sarah, and maybe Fiona, and I'll chip in as well about what the role of the IJB is in terms of clinical governance. So your thoughts on that?
Thank you, Andrew. That is a really difficult one, because I think when we started the short life working group, and if I look at some faces around the screen, I'm thinking the support of Laura and Claire and John, is that it was very difficult to actually look around what the answer to that question is. And I would welcome your thoughts as well. I suppose for me, it's how we are providing assurance to the IJB that the care that we're providing to our service users in East Lothian is safe, effective and person-centred. And I suppose if I'm thinking back to the professional paper that we produced last year, it's around how we're able to escalate and get the support from the IJB around ensuring that we are achieving the clinical governance under those headings that we want to. But I would welcome your input on that as well, Andrew.
Fiona Wilson first, before
I was going to invite Laura in as well as part of that. Kind of should probably say, oh, Fiona. But I think to be fair,
no, we're all saying, oh, John. It's,
no,
it's not, John. I've been having this conversation with Fiona, and I think we need to understand this and come to a conclusion around it. So, Laura first, then David.
Yeah, thanks, Fiona. So I think that's right. So I think this paper is really telling a story giving the narrative around how we are assuring ourselves and how we will assure the IJB of our clinical care, health and care governance. What the statutory requirement is for the IJB is that we will present the clinical and care governance report on an annual basis, and that's what Sarah will do. Now they have set up the meetings in a more formal way and doing all the things that Sarah has just described. So what the IJB's responsibility will be is to look at that report, which you haven't got just now, but you will have, which will outline how you are comfortable and assured that the governance of clinical and both health and social care and social work are being managed by the partnership, and that will be done by the annual report that should come, and that's a statutory requirement of the IJB.
Thanks, Laura. David?
Yeah, just thinking this one through and coming back to John's question in terms of the role of the IJB. I think so that IJB responsibility for strategic planning and commissioning of services, integral to that is the quality, safety and effectiveness of those services as well. So I think there's an inextricable link there for the IJB in terms of understanding the quality, effectiveness and the governance processes that are in place so that the IJB can discharge that primary responsibility. And I think if you try and triangulate that, I think that quality and safety is a fundamental part of that. And I think Laura's obviously described the statutory responsibility, but I think this is a key component for the IJB in terms of being able to discharge that overarching responsibility in terms of the strategic plan.
I thanks, David and Laura. I completely get all of that. The bit I think is worthy of some further conversation is that NHS Lothian has its own governance processes and the HSCPs report their governance to that. And I am assuming that is for social work that goes through to the council. So we have other reporting mechanisms for that level of assurance. And it's how do we reconcile that or avoid confusion, because I'm not quite clear where those three overlap and what the role of the IJB within that. And I don't propose to try and answer that question today, but I think it's a question that certainly as voting members, I think we'd welcome some further conversation with officers on this, just so we are clear in our role when we're sat here as an IJB, what our role within that is. Laura first.
I think, has Hayley just dropped off? Because I was just about to say, I think it's good that Hayley's here, and maybe we should be incorporating that into the development session we have when we talk about the standards, because I think you're right. I think there is duplication. I think there is a need for governance on each side, and it's reminding, and it's funny, we've had a very similar conversation around the strategic plan and the sign off of that. It's reminding partners who's now got the decision-making power, and sometimes it is actually the IJB, but you perhaps haven't realised that, and it's the importance for us as officers to show that and to emphasise that. So I think probably we want to tie that into that development session around standards and reminding IJB and our partners who has authority over what and who makes decisions over, or when you make a decision. So yeah, I think that would be helpful.
John, you asked the original question. Are you happy that we wrap this up in a further conversation where we can actually maybe, as Laura said and others have said, we can get a bit more into the detail and understand where the different organisations fit?
Yeah, I think so. I mean, some of this drives. Yeah, obviously we have our responsibility as voting members, as you say, but it affects us. You know, just in terms of say reading these papers, you know, I struggle a bit in terms of knowing what I should be doing as a member in terms of really reviewing and understanding and commenting on these papers in relation to the clinical piece. We'll get to this in section 5, won't we, in a second, I guess, about the Healthcare Governance Committee annual report. And I find it hard, you know, but it's gone through other committees anyway, so I get comfort there. We'll talk about. So yes, I've got a level of uncertainty which would be good to clarify around this area.
Could I just ask Shamim or any of the other councillors for their thoughts on this? Because that was quite a number of NHS Lothian board members commented. So Shamim.
Yeah, no, I just think I find that a useful paper, Sarah. But one of my thoughts was around as a integrated joint board, how do we communicate that as an integrated joint board? So we've got a lot of information around the structures of NHS, and then there are structures from our other partners as well. So I'm not sure if Lindsay's on the call today. It was the Chief Social Work Officer. We have the Chief Social Work Officer report that went to Council on February 2025. So it's a bit around, and I suppose when we're grappling with these challenges, I'm also mindful of the lead officer's report that came in December last year about the impact on services. But how do we, as IJB members, get this information across as to demonstrate we're an integrated body, that you would have both partners working together, highlighting the governances on both sides, and that might be helpful because covering social work and social care is so important as kind of the front line of supporting individuals, and how we do both. So that was a little bit I wasn't sure about, but maybe the development session might cover these are the ways these checks and balances happen in both organisations, and as IJB members, the paper should also be presented in an integrated way, if you know what I mean.
I certainly I don't recall seeing the Chief Social Worker's report, because if that went through the council governance routes, it won't have come here. So I think it's worthy. I think it's really important what you've said, Shameen, and we try somehow to pick some of that up. So I'll come to Sarah first, then Laura, then John. Sarah.
Thank you, and thank you, Shameen. A very valid point. And I think for me, it's about providing that assurance to the members today that we do. Our Clinical Care Governance Committee is very much made up of members across all of the teams. So we certainly have input from social work. So social work have their own governance framework, and then they report into our Clinical Care Governance Committee. And certainly this morning, one of the reports was very much focusing on some of our social care as well, and the impact on that. So that's something we've really driven over the last 18 months, is to make sure that we're including all aspects of team within the partnership, because I think as John alluded to before, we don't work in isolation, or we're very much promoting not to work in isolation, and it's how we sort of measure how each team's impacting on the other, etc. So I think we've probably just got it right with our engagement in the committee and how we're achieving that. But you're right, it's then how do we make sure as we're reporting that it's coming across as being integrated as we're reporting, and that will need to be our next step from that.
Thanks, Sarah. Laura?
Thanks, John. Didn't realise you'd put your hand down. Yes, I would agree with Sarah on that. I just want to reflect back on the Chief Social Work Officer report, because that report does and should come to the IJB, and it's maybe just missed. Obviously, Neil and we did a big kind of list of all the statutory reports that need to come to the IJB. So again, we can do that in the development session, rerun that through for everybody so they can see these are all the reports that are going to come. This is why you see them, and this is what you have to do. And I think that'll be, as Jonathan says, really helpful just to remind you, okay, when you're seeing these, what's the ask? Is it just to agree, or do you need to get feedback and some kind of conversation and discussion? So, but the Chief Social Officer's report, I don't know why that hasn't come, because it should. It does come every year, and we certainly input into it when it's being written. But perhaps that's an action for Lindsay Byrne can be taken from today's meeting.
It may be that I had just not recalled it from recent meetings.
No,
Laura,
it would normally come now, and if it's come to council, it should have come. So I don't know why it's not come.
Okay, we again want to pick up. John?
Yeah, it seems like one of the primary functions will be to avoid duplication, confusion, and maybe even contradiction, as you said earlier. But recognising that the IJB's role is a unique one in that they have oversight over both the health and the social care side of things, and it's those exceptional bits that require that oversight that is maybe the important bit that needs to come to IJB. Recognising that the other reports have been approved by the other organisations, by the partners already. And I guess on the back of that, my question is, do we know what other IJBs are doing to resolve that quandary? And that might be useful to find out before we have the development group meeting. Thank you.
Thanks, John. I'll take up that to go to the IJB chairs and vice chairs network and just at least ask the question, how do people pick that up? And that I think might be an important part for our further thinking and development. My final point on this is that, and it's so important because as the challenges of funding, etc., impact upon IJBs, we have to have a mechanism to assess the impact that has on the quality of the care that we deliver, and we need to keep that closing that loop all the time. So this is important work that we need to do. So in summary, John, I think you've raised a really important. I think we've been thinking about this and looking at this. You've formally raised it here. The action is that we'll pick this up as part of a development session, maybe linking it into the standards, and we can have some proper conversation around this. I think by then, Laura, the Chief Social Work report will have come into the reporting cycle, so we'll be aware of that, and at least we can do our best to get some clarity, avoid duplication, and really understand what the role of the IJB and we as members, as a strategic planning body, have in relation to this. So I think those are final words on that one. So people okay with that? So we note agenda item 6, Sarah. We now move back to agenda item 5, which I think starts at page 71, which is the report, the Healthcare Governance Committee report that is being presented at the IJB. So.
Thank you, Andrew, and apologies to the member that I did do it the wrong way around, so apologies for that. So my report is to update the IJB on the Partnership Annual Report that was provided to NHS Lothian Healthcare Governance Committee, and the IJB is asked to note the content of this report that conforms with the standard reporting required to be presented to the IJB on an annual basis, obviously linked with our previous conversation. So the annual report is included, and this was submitted to the NHS Lothian Health and Care Governance Committee for discussion on the 23rd of September. The aim of the report was to provide the committee with an assessment of the quality and safety of care provided across East Lothian Health and Social Care Partnership services and the work undertaken to address risks and improve quality and safety. The committee was recommended to accept moderate assurance that we have comprehensive systems in place to deliver safe, effective and person-centred care. However, it was noted that due to some recent SPSO reports that have been received across NHS Lothian, there were some concerns around ongoing work around pressure area care and wound care. And so the Healthcare Governance Committee accepted that limited assurance was to be provided around this area of work. And it's detailed in the report, some of the work that we've been doing around that. We presented the report, so it was myself, Fiona, John and Leslie Berry from an AHP perspective, very much wanted to present, well, we do approach this from a very much multidisciplinary team perspective, and certainly the report had contributions from all the teams that provide care, and I'm grateful for that. Just to note, as part of our conversation that we had just now, that this is very much a health-based report, but to note that social work and social care governance comes through our Clinical Care Governance Committee, and moving forward we'll look at how we integrate that into the report as well. And I think there's a place to integrate some of that even into going up to the NHS Lothian Committee, because as I indicated before, we very much work collectively to achieve that safe and effective person-centred care. So that's an action for me for next year's report, to make sure that we represent that a little bit more clearly. I suppose I just wanted to note as well that governance is an integral part of our clinical and professional roles, but actually with the increasing demands of the workforce, making sure how we're providing that evidence, reviewing our data, etc., can be quite challenging. And as senior leaders, we need to think about how we continue to achieve that and move that forward. And I think a key thing for me around that is that visible leadership of us, leadership around our clinical leads, and that is something that we're very much focusing on. I'm not going to go into every detail of the report. It's a very long report, and it would probably take me all afternoon to do that. And I would welcome questions around the report from members. It very much highlights some of our key risks within the partnership, some of our ongoing work. It reviews some of the challenges that we've faced around our own services and our hosted services as well. It looks at some of our safety concerns I've already mentioned around pressure ulcer and pressure ulcer care, and some of the work that we have been doing around that within East Lothian. I think the work that we've been doing there really highlights how, when we have patient feedback through complaints, how we very much review our processes and look at improvement work, and I think that very much highlights that. There's a huge amount of work around our unscheduled care, and we've detailed our data within that as well. One of our key risks at the moment is around falls within the partnership. That's not only from an inpatient perspective from care homes, but also within the community as well. And very much the paper looks at some of the improvement work that we're very much focusing in our inpatient areas, but some of that learning from that is very much being progressed into our community settings as well. And I think probably I will leave going through the paper at that point, but we'll welcome any questions on the details of the paper.
Thanks, Sarah. And first, I'll just do a quick transparency thing, just so people are aware. I chair the Healthcare Governance Committee for NHS Lothian, so this is not a conflict of interest, but I just want to make sure that there's some transparency. So I've also seen this paper 3 times now as well, so my comments will be more limited today. So we'll open up to some comments and observations. Elizabeth first.
Thanks. Thanks, Sarah, for that report. Just wanted to ask, obviously, that in your report you mentioned that the SPSO had advised that additional complaints training should take place. Was that specifically to do with improvement works following on from complaints, or was it a wider point about how complaints are handled in the partnership? Thanks.
Thank you, Elizabeth. So that was as a learning outcome from a particular SPSO report for East Lothian, and it was around how we gathered information around a response to a complaint and how we dealt with that information. So as part of the learning from that, we've done a huge amount of work. So I attended the SPSO training myself to review that and see how that compared to the training that's provided from our patient experience team within NHS Lothian. And then we've also ensured from a patient experience team perspective, we've asked them to deliver education on complaints or refresher on complaints to all of our senior teams. So certainly all of the general managers, the professional leads, and our clinical nurse managers and our Band 7 team leads have received that training. So that's something that we have really focused on and learned around, how we make sure that when we're responding to complaints, we ensure that we have all of that information available. In addition to that, Fiona and David lead a weekly complaints meeting, which is mentioned in the paper, and allows us very much to focus on where we're at with complaints, but if we have any concerns around what information we're providing, or if we need any support to ensure that we're getting all of the right information. That is our escalation point.
So, okay, Elizabeth.
Yes, thanks.
John, Jonathan.
Hi, thanks, Sarah. I've actually got quite a few questions, so I don't quite know how to structure these. But I guess firstly, just as an admin piece, it says looking at, quite important to me is the root of this paper, who's discussed it before it comes to us, and we obviously just sort of had that sort of conversation to extent. The paper says it was reviewed by it went via the LSRH SMT, but I can't see anywhere who that is. Could you mind telling us who that is? LSRH SMT.
Yeah, sorry, Jonathan. I read that again in the paper, and I think that is a typo error. So apologies for that. I will take that out of that.
So it's not someone else. It's just a mistake, is it, or is it?
It is a mistake. I'm not sure where that has come from, so I apologise for that.
Right,
when I was reviewing it, yeah, because our process.
I looked everywhere for it twice or three times, thinking I was just being a bit silly, and I couldn't see it anywhere on the entire paper. So I'm sorry. Okay, good. I guess it's overarching comment is around. Yeah, again, our role, I suppose, and I'm very interested to hear. Unfortunately, Andrew, what the discussion was and the discussion at the Healthcare Governance Committee, because I suspect you've had a much more detailed time, you have more time to talk about this paper. It's obviously in your wheelhouse and stuff you sort of do anyway as your day job, Andrew, in that committee, which we don't do here. And obviously, it's been accepted that this is a moderate assurance around delivering systems delivering safe, effective, person-centered care. There's comments in here saying that we perform well compared to national indicators. We're ahead of previous year, improved on previous year, ahead of most Scottish levels. Sarah, I'm not sure. I don't really see any of that data in this report, so I'm not sure how I guess my question is, how did healthcare governance kind of get assurance in relation to these recommendations and comments? Because there is a huge amount of information in this report, which is great, but it's sort of more narrative, and I really struggle to sort of piece it together as an overall assessment. So I guess I get a lot of comfort that it's gone through healthcare governance already. Obviously, this is only for noting, so I apologise for that. But you have presented it to us and asked for questions. So it's just.
I'll briefly answer that and then ask John and Sarah to come in. Is that what isn't included here were I think 11 appendices that came with this report, which was the supporting data set to that. I think that would have been overwhelming for this committee, considering that has already been through a governance process. So there is the data to support it, John, and we consider at Healthcare Governance the narrative with the data pack for not just East Lothian, for 3 other HSCPs at the same time. So we are able to take an across HSCP Lothian view on it. That's our mechanism. So maybe that's an offline conversation that we could have got around to, or I'll go through that in more detail. But there is more data than is presented here, and the narrative is here, but there are significant appendices and data to support that. In terms of the limited assurance around the wound care, I think this is relevant here. That was an issue that was picked up across all 4 HSCPs, predominantly not East Lothian, but because the processes were very similar, it was felt that limited assurance across all of the HSCPs and acute for wound care would be appropriate, because the action plan to address it, and I'm sure Sarah will comment on this, is an integrated action plan across the 4 HSCPs and acute. So we weren't viewing it in the silo of an individual HSCP, it was across the whole of the Lothian footprint. So that's John, I'll have a separate conversation around some of those things, but I hope that helps. But if Sarah and John want to add to that, then please do so. So Sarah first, did you?
No, I think you have summarised. Thank you, Andrew. And yeah, there is a huge amount of data that we do provide, and I suppose from a senior professional perspective, we also analyse that data as well before we then request moderate assurance within the paper. And I think we are very clear, and healthcare governance are very clear, that we would not be providing or asking for moderate assurance unless we have that assurance behind us to be able to evidence that as well. I think, Andrew, do you want me to comment around the pressure ulcer work as well? So I think, as I noted in the paper, that as Andrew has described, it's limited across all the partnerships and also the acute sites as well. One thing that we had started in East Lothian prior to the SPSO cases, and I think I mentioned at my initial narrative that we had a couple of complaints and SAEs around pressure ulcers. We took those through our PSAG meetings, and we very much started some of our improvement work around that. And that improvement work was around auditing of notes and care provided by our district nursing team, engaging with our tissue viability team, requesting education for our district nurses, and a real review of our systems. And then after the SPSO cases, we were then able to go back and say where we were at with regards to progressing our improvement work. There is now a pressure ulcer collaborative that has been set up across the system in NHS Lothian, and certainly we are very much part of that from East Lothian. We have a representative. We're about to put 5 more people into that collaborative, really engaging with that overarching improvement work that we need to do. And that's very much around staff education, skill set, but a huge amount around looking at our data and how we're providing that assurance around documentation and care that's being given.
Sorry, Shameen, before I come to you, John, are you happy with that? The stuff I can pick up with you offline, but you're right, it's here at this committee, so these are things to raise.
Yeah, I think that's right. Yeah, it's right, and I explained it well, and that's, yeah, let's say it gives comfort. But that bigger, deeper discussion was had at healthcare governance. I mean, maybe this would apply to the social work report come through. I mean, just from my perspective, Sarah, it might be helpful for these reports to have a little bit of a executive summary of some kind, maybe with some of the key data points, just so because there is so much here, and as Andrew said, there's quite a lot missing. So it's kind of, this gets back to that original question we had in section 5. I'm just struggling to kind of understand what my role is, and I want to do a good job for this board, for this committee, and I struggle because I don't quite know how deep I need to look into this and what the technical information I need to sort of do that review. So I appreciate, and I get comfort. It's been assessed as moderate assurance. You've obviously looked at the parameters around Andrew HGC, so that's fine. And actually, my second question was actually about the pressure ulcer piece, and you seemed, and the only bit, Sarah, to add to sort of ask you is, are you actually seeing, you know, an empirical improvement, I guess, in terms of the data coming through, in terms of the number of cases? You know, you've talked about training and other things, reporting. Are you starting to see green shoots of improvements through these efforts?
Want to come back on that, Sarah?
Yeah, of course. Thank you, Jonathan. So we're not seeing a reduction in the pressure ulcers at the moment. I think we probably will see an increase in the amount that are reported through our DATEX system, and that's when you start to increase awareness and look at your processes, you will see an increase. The thing that I am having assurance about at the moment is around the fact that the staff have had additional education. They are now recognising the different grades of pressure ulcers, so you'll have them from grade 1 through to grade 4 and ungradable, and we were finding a challenge, and the staff didn't have the confidence around how they were grading those. So I'm certainly seeing an improvement in that. What I'm seeing an improvement in is around our documentation. So I'm not saying it was poor at the start, but what I'm seeing is an improvement. So a real improvement in around how we're documenting, how we're grading. We are certainly making sure, I talked about visible leadership. We're also making sure that our clinical leads within our community nursing are very much out with the teams, more reviewing notes, etc. So I have more assurance around that as well. One of the challenges that we face with pressure ulcers is that often the community teams will be referred pressure ulcers from our GP colleagues, and these are of patients who they have not seen before, they haven't been admitted to hospital, but for maybe reduced mobility or a sudden illness, they're developing pressure ulcers in their own homes. And so for me, there does need to be a bit of work, or a lot of work, I should say, looking at how we actually, the prevention side of it. So we're very much focusing on preventing when somebody's an inpatient in a hospital ward, ensuring that pressure ulcers don't get worse when we're looking at them looking after people from a community perspective. But it's actually, how do we provide that education and support for people before they get to that stage to actually prevent pressure ulcers. So through the collaborative, we still do have a journey to take. We absolutely, but we're very much on that journey. And I do have assurance, Jonathan, that that I am seeing improvement. And I think for me, what's really positive is that we are discussing it at all our governance groups. We're making sure that it's a multidisciplinary approach. I'm not sure if Leslie's on the meeting from an AHP perspective, but certainly we're making sure that all of the teams are involved in these conversations and that we're talking about it, and that's really provides me with the assurance. And I suppose just to come back on your other concern, Jonathan, around from a healthcare governance perspective, I can assure you that when we sit at healthcare governance, we are very much asked lots of questions around our data, and we're very much challenged on some of the aspects of the report for then Healthcare Governance Committee to be able to support their decision.
Great. Thank you, Sarah. Thanks, Andrew.
Shameen, thank you for your patience there. That was, please come in.
I think Leslie might want to come in on this
Oh,
point.
Leslie, I'm sorry, Leslie. Thank you even more, Shameen. Leslie.
No, just to agree with what Sarah said. In fact, the director of HPs asked if anybody was involved in Lothian, and we were the only area initially who had HPs. One of our OTs is very much involved with the committee in East Lothian, so we were very assured that we were definitely involved with this right from the beginning and are keen to be involved right through the process.
Thanks, Leslie. Shameen.
Yeah, no, thanks, Sarah, for the report. It was on the section on unscheduled care where government money was passed on to reduce delayed discharges and ease the pressure on acute. And I just wondered if you're able to expand a little bit more around that. So we know about resources for the next year, and I think the way to crack it is to support care at home, social work, social care, community-based services. And I wonder if you're able to say anything around the longer term of that work, if we want to get a sustained way. I'm not sure whether government will keep providing that level of resource, because it was a significant level of resource to be able to keep sustaining those services. But I just wondered if it got in the longer term around that. And the second one was at the top of page 75, there's quite a lot of information around mental health and bed usage and the single point of access to support. And we know that's a problem right across the board of supporting adults with mental health and mental health crisis. And I just wondered, when you're discussing those, do you look at that in possibly an integrated way where housing have stepped in to support adults with mental health issues around Elder Street and Penumbra? And I just wondered if these conversations also take place, that while you're looking at the pressures, there's examples of where those pressures might be, those projects might help to alleviate some of that pressure. Just those two areas were the ones that I had queries on.
I see both Fiona and David's hands up. So do you want to respond to those questions, or do we ask Sarah to respond first?
I was going to welcome Fiona to respond.
Yeah, so I'll do the unscheduled care, and David, I think, will pick up on the mental health. So good question. And I suppose in the context of the report, you know, we talk about unscheduled care. We had money from the Scottish Government last year where we were asked to support the front door of the Royal Infirmary to improve their 4-hour performance target. And with that, we were asked to focus on occupancy, reducing occupancy and delayed discharge as part of a whole system. And our target was for East was 112 people we needed to have in at any one point, and that took us to really, we had a bit of a stretch target to under 85. The money was given with the view that it would be recurring, but it had to be recurring on the point of view of we needed to, as a system, reach the performance target. So from an East perspective, Gillian, I don't think welcome me back this week, because actually the team have been managing to get it to 102, the number, a real improvement around the kind of occupancy that when it's at that, it's sitting in the 60s. And this week it's gone up, but we've shown real improvement, no health delays, reduced social delays, and the occupancy, so the metrics. But again, we're just one small cog in the system of Edinburgh and Mid Lothian, who all need to contribute to that for our performance target. So I guess we can say good things, Shameen, just around length of stay, getting people home. You're aware, because we've rehearsed this several times. We put this into care at home. We put this into social work. We put this into enhanced therapy at home, a real home first approach. That's where we targeted our resources. So absolutely, and getting people to the right place at the right time. The challenge will be, as a system, we need to improve that performance target. So is there a question if we get it recurringly, and we need the other systems, particularly Edinburgh, to be at the same level of improving that target, and that's been variable at that stage. So that just gives you a bit of context. I think there's a real risk around the recurrency, even though East have delivered.
Shameen, is that okay, or do you want to?
Yeah, I think it might be something we go back to about the long-term sustainability of it, and just looking at projects that we know work, like Home First, work on the ground, that we know make a difference, and how we kind of, as an IJB, prioritise where areas where we know there's going to be significant improvement.
David, do you want to come in on the mental health question, please?
Yeah, I can come in on mental health, and Shameen, thanks for flagging. I think the story in terms of mental health actually is very similar to unscheduled care and the physical health, in that we, from a flow performance patient perspective, perform well, and we have that integrated approach within East Lothian. And Shameen, you mentioned things like Elder Street, but there's the recent Farside development as well, and we have that kind of very good relationship with housing in terms of what are our needs going forward for our residents, and trying to project what where they are, and then how does that link in with the housing strategy through the Housing Partners Board, etc., which we are a key component of, and link in. From an occupancy perspective as well, East Lothian is, I'm going to say, the best performing board or local authority area partnership, HSCP, within Lothian. We have a small number of patients who are in the Royal Edinburgh, and I think our length of stay is the lowest of all of the health and social care partnerships. Now, there is still significant pressure on our mental health services, both in patients but also in community, and we see that through some of our teams in terms of being able to keep people at home. And there is improvement work that is ongoing, that we are a key part of, in terms of how we do that and how we reduce the occupancy in hospital and support people at home. And we are doing that on an integrated basis. We have very good engagement. We have a daily huddle, for example, where we look at all of our patients who are either at risk of being admitted to hospital or in hospital, and we have the multidisciplinary team, including social work, around the table when we're having those conversations, so that we can try and support people. So there is that integrated approach, and I think it works well. And as we go through the further improvement work around things like supported accommodation, which we might have to do on a wider basis, for example with Mid Lothian, what those options are in terms of how we develop that. But I think we've got good processes and structures and integration around that at the moment, and be very happy to kind of share that, and I'm sure Guy would be as well, at a kind of more detailed position.
Thanks, David. Fiona, to come up and try and conclude on this.
Yeah, I suppose I'm just thinking back to kind of what Shameen had said at the start. I suppose I'm confident, and we can evidence it through data, quality metrics, what we are doing and how we are choosing to commission pieces of money is doing well and getting the outcome. I suppose my desire is that others would follow suit, see what East Lothian are doing. And we've done some pump priming ourselves without the Scottish Government money of taking the risk. If we think about the InReach model, we would want others to do the same, so that we could get that transition, because if we can get occupancy and that drive and just the momentum of people need to be in the right place at the right time, but ultimately we want them in their own homes and or a homely setting. That would be my desire as a system of how do we influence that with the good work of East Lothian, because I do think we're getting it right, and we've demonstrated with where we've put our money. Yes, we could go further and more, but that I think there are opportunities. I suppose that's a bit of, I think, David, when we're sitting in these meetings, the reflection of some of the work is already laid out. We just need others to kind of follow that plan. I'll stop talking now. Apologies.
And we have talked about transformational work across IJB stroke HSCPs and jointly with the acute sector. Is that the space that you're talking about there, Fiona?
Yes, and then some of that David and I are trying to influence, as are others around the back. So Laura with some of the joint commissioning, we are within our kind of ops meetings and executive level and program boards, but it's the pace that it needs to happen, and also recognizing that not all IGBs are in the same position as us. So all of this comes into it.
Brilliant, thank you. Colleagues, I'm seeing no more hands. This report is to note, and we've had a good 45 minutes conversation around this. Can I thank Sarah and John and Leslie and colleagues who contributed to the report and to the conversation today. I think it helps certainly members in our understanding of the complexity of the clinical services that are provided on behalf of the HSCP and IJB. So, and thank you. And the moderate assurance that is noted at healthcare governance is a very positive and a very strong endorsement of the work that is ongoing. And I still think there's some more work to do, and we noted that from the previous comments around how the IJB and Council and Lothian integrate and avoid duplication on this. So thank you. A final word to you then, Sarah.
Thank you, Andrew. Sorry, I just wanted to back on Jonathan's original question. I'd had a mind blank then around what the LSRH, so that is our Lothian Sexual Health SMT. So that is part of the structure that the content went through. So I just wanted to clarify that.
Thank you. We shall add it to the list of acronyms of committees that exist within our system. So thank you, colleagues. A good and positive conversation around those important clinical governance issues. We move on to agenda item 7, finance update. I think Mike, I've seen Mike here, so I'm going to hand it over to you, Mike, to take us through the report, please.
Thanks, Chair. Good afternoon, everyone. Apologies for my late arrival, technical problems. So this paper, the finance paper that I'm brought to today's meeting, sets out the Q2 financial position for the IJB, and it provides an update on the forecast position for 25-26. It also provides an update on the 26-27 financial plan and gives an update on the financial planning process from now until the year end. So hopefully everybody's had a chance to go through the paper, have a look at it. So I just want to sort of take you through it and highlight the key aspects, if that's okay. So those of us who were at the last meeting, Colby said that the Q1 financial review was a very early indication of the potential financial position for the IJB. The Q2 position represents 6 months worth of activity and related costs. All the budgets are in the right place, they're all phased correctly. We've got a far better understanding at this point in time of the financial challenges and issues that are facing the IJB. So it gives us a better indication. So whilst all the overall position hasn't really changed much, a lot of the variances within that position have moved in the Q2 analysis. So the table at the top of page 2, that sets out the key variances across the services. And you'll see that the core health position has deteriorated a little bit, and that's largely as a result of prescribing for spend, which has increased significantly from Q1 to Q2. This is mainly due to changes and increases in the price and volume, largely across Lothian, but particularly in East Lothian. And there's work underway to understand the drivers of those changes and also what we can do to mitigate that going forward. The hosted and set-aside services are collectively largely unchanged, although they're largely unchanged and at a similar level to quarter one. Although there is a sort of increase in the mental health pressure in quarter two. Council delegated services, they're presenting an increased underspend position with largely movements across different services. The increase is driven by an increase in income across older people's services and also ongoing vacancies within the rehab service. In terms of forecast to the year-end position for health, this has moved from an forecast overspend of 155,000 to a forecast overspend of 651,000, and that's largely driven by the impact of the prescribing position this year to date and forecast going forward. Within council delegated services, there are a few areas that are difficult to forecast, particularly the level of income that learning disability services may recover from clients in housing association dwellings, and there's also a likely cost of the new core and cluster development within learning disabilities, as we're in the process of sort of finalising that contract with the provider and understanding that all the clients that will be going in there and the impact on the financials. So there are a number of uncertainties within the council forecast position, and that's led me to present a break-even position for the council at the quarter two stage. The forecast overspend therefore largely relates to, or fully relates to, health services. I'm aware of a number of proposals that are looking to mitigate that process for that overspend going forward. Partly within mental health, where we're hoping that we're expecting to see some additional funding potentially come into that area. And as I said earlier, there's work underway to try and mitigate the prescribing position. So at this stage, I'm recommending that we monitor the overspend. We don't need to take any further action at this point in time, because I think the situation may well change as we go forward. If we move to page 3 of the report, updates on the efficiencies, gives us an up-to-date position and a forecast for the rest of the year. The year-to-date, there's a small under-delivery against the health efficiency programme, and that's mainly within hosted services, and the council schemes are all on target. A number of additional efficiency schemes have been identified within health services, and those will offset the under-delivery that I mentioned above, and also increase the planned and forecast delivery of efficiencies, particularly within core services. The paper goes on to provide an update on the IJB's medium terms, that's our 5-year financial plan. And that's following updates from both partner organisations. So the council have updated their financial plan and the health board have updated their financial plan as well. The health board has only updated theirs for 2026-27. So that's why I'm only able to present, or only want to present, a position on the 26-27 financial plan at this point in time. We'll get a fuller update on the financial plans going forward, and probably more detailed ones after the budget announcements in early January. So in terms of the updates themselves for this particular report, the assumptions underpinning the partners' plans are set out in the paper. The main movements are within the council's assumptions and financial plans, so just drawing attention to those. One of those assumptions was around the pay and the fact that the Scottish Government have confirmed that they will provide full funding for the additional 0.5% pay rise for council staff going forward. So that is assumed into the financial plan position, and we would expect that would be passed on to the IJB. The council and IJB will also expect to receive update or the increase in real living wage that the council receives each year. So that's not always, or that hasn't been a feature of the financial plans in previous years, but we receive it every single year, so it seems reasonable and sensible to put it into the financial plan process, and it's passed through to the IJB, so it's assumed in the IJB's financial planning process as well. And there's been changes to the general inflation rates that were in the original financial plan to reflect changes in the economic situation as it is now. So all of these updates are reflected in the revised 26-27 financial plan, and that shows a financial gap of 5.6 million, which is down from the original financial plan, which was 7.5 million. So it has had a material effect on how we forecast or what we are projecting to be our financial position for the start of next year. And I think it will change again as further iterations of these plans come out and the budget situation becomes clearer. Previous financial plans within the health side of things have passed on non-pay uplift when it has been received by the health board. That's not in the financial plan position at this point in time, but if the health board receive non-pay uplift, then we would expect that to be passed on to the IJB, and that will be something that we will be looking to make sure happens in future iterations of the plan. So these figures are before any efficiencies have been taken into account, and the work, just to give the IJB assurance that there's work going on as we speak behind the scenes in identifying these efficiencies for next year and for future years. And the impact of, or the outcome of all of these deliberations will be brought to the development sessions that we've got in the diary coming up in December and January. The paper also highlights a number of risks that come out from these changes in the financial plan. One of those risks is around the pay award for council staff. So whilst the Scottish Government have committed to giving the council an extra 0.5%, but the original assumption in the financial plan was 3%, and obviously the council and the IJB are dependent on their settlement covering that, and the council being able to afford or be able to fund the 3% in the financial plan and pass that on to the IJB. There are further risks around pay, and that in relation to the inflation guarantee that's aligned to some of the public sector pay agreements. There's a risk that guarantee may come into effect and that the Scottish Government may not afford to or be able to fully fund that. There's further risks around the NHS reforms that are underway at this point in time. These are largely changes to terms and conditions within people's working within the health board, and they have a financial implication. So the main ones, or the three reforms that are underway at the moment, are the reduced working week. So from the 1st of April next year, all Agenda for Change staff in the health sector will reduce from 37 hours to 36 hours. And there will be a financial implication of that. There's also work underway at the moment in terms of Band 5 to Band 6 nursing regradings, and there's an implication for protected learning time that is being afforded to staff to allow them to do their training. All of these aspects have financial implications, and we need to make sure that the Scottish Government these are fully funded in the budget setting process. So there's a risk that might not happen. And there's also obviously a risk around us not receiving full funding for all of these risks that I've just highlighted. The last section of the paper just notes the importance of the upcoming Scottish Government budget announcement on the 13th of January. And that will dictate the changes in the partners' financial planning processes and the outcomes in their financial plans, and the resultant gap that the IJB will have to consider going forward. The upcoming development sessions will concentrate on the outcomes of those financial planning processes and the gap that the IJB has to consider. So that's all I wanted to say. If there's any questions, I'm happy to take them.
Thanks, Mike. You were a bit Dalek-y at the beginning of that, but it cleared up for me, certainly about
Sorry.
2/3 of the way through. No, it wasn't worth. I got most of it. I'm hoping most people caught most of it there. So, so we'll open it up to any comments, thoughts, observations first. The paper is just to note at this stage, isn't it, Mike? But useful to take any questions. Okay.
Yep.
Shameen first.
Yeah, well, thanks, Mike, for the paper. Just one of the areas that we have quite a lot of discussion around is the set aside. When we're discussing it, I just wondered if you're able to give us any detail around work going on behind the scenes around set aside, because then what usually happens later on in the year, that's one of the budget areas that does overspend. And I just wondered if you could share with us about kind of level of rigor and discussion that's happening behind the scenes to look at that budget and East Lothian section of that, and how we can do things differently to prevent some of those overspends.
So Fiona might want to comment on this as well, but we are looking at what in terms of East Lothian, how we sit in that process, and looking to see if we can bring a set of sort of policy changes, if you like, or policy rules around how the allocation of set aside services is taken forward in the future. So we're looking at setting out a set of principles. That's what I was trying to say. Sorry, a set of principles that the four partnerships can agree to around how we allocate the budgets and to spend against the set aside services, that makes it as reflective as possible of what's actually happening on the ground, and is fair across the partnership. I don't know if Fiona wants to add anything to that. It's very early stages of that, and we've just started the process ourselves in terms of looking at how East Lothian sits in that process.
Anything to add, Fiona?
Yeah, I guess. Yeah, so set aside is of real interest to us. I think the challenge is we don't operationally manage it day to day, whereas there was some of the other budgets that from a core coming through. But I suppose we're keen, and we have started the discussions, and I think we've shared this before actually, just around what are the opportunities around set aside. And given some of the discussion David and I have just shared with you around performance, are there opportunities to do things differently, particularly around either bed-based, shared use of resources? So these conversations are happening as part of that. But I suppose it's that balance of the strategic commissioning role that we take, but also from the HSCP, the operational element doesn't sit with us. So early days, but I agree, and I think we've said this time and time again, that's an area we need to get into.
And will we start to pick up some of those elements at one of the development sessions? Because no matter how many times we go around this, there's more I learn about set aside whenever we discuss it. So Mike, just something to factor into your thinking about how you structure that development session, the next one in November. Just give your thoughts to that.
Yeah, no,
Shameen,
thanks, Mike.
to come back, Shameen, come back on that.
Yeah, no, that's really helpful, because I think it's been for a number of years we've talked about set aside and how we influence that. So it'll be, I think, looking at the lead professionals officers report about the budget and the impact on staff, I think it's imperative we get in amongst that and see what we can do differently, listening to what staff are telling us. And just secondly, more, it was just a comment, Mike, around the core and cluster for learning disability. It may be something you could come back on, that just seeing that on the ground of what benefits that brings to East Lothian IJB, that if we didn't have that core and cluster, where would those individuals with learning disabilities be placed? Would that be an external placement? But that's something you could get back on around that, because I know there's a huge amount of work going on in partnership to try and reduce costs and do things differently to support individuals around learning disabilities, and I think mental health is another one.
David, do you want to comment on that? I think that's an operational matter rather than finances.
Yeah, I can briefly comment on that. And so I think this is a really important opportunity for us in terms of core and cluster. And as an example, the recent Farside development has allowed a number of people, or will allow a number of people, for example, who have been in hospital for a very long time, to come back and be cared for closer to home. There are a number of people who have significant risks in their current properties and where they are in the community, and actually being able to use core and cluster will be better for them as well. So I think, and there's also the opportunity for some people who have got placements out with East Lothian and perhaps quite far apart, bringing them back closer to home as well. So I think there's a real kind of combination of opportunities with core and cluster. And yes, we've just had that far side development, but then through the kind of the work that I described earlier on and contribution with housing, it's looking at about, okay, what are the next steps? What is the demand coming up from different groups of clients going forward, and how do we meet that in terms of future developments and things like that? And that is part of that housing strategy going forward, to make sure that we can look after East Lothian residents in East Lothian and avoid having to use either out of area placements or hospital-based kind of facilities where that's more appropriate for them.
Yeah, thank you, David. Just from a finance side, I'll leave this with you. You may want to come back on it. What financial benefits have we gained? Because if those individuals didn't have that, if they would be going to an external placement or a hospital, and it may be that as an IJB we've got a strategic direction of that, you know, one way of delivering those services through core and cluster.
And yeah, and we can, sorry, Chair, just to jump in, but we can share some of that, because that is part of the conversation that we've had around that far side development is, you know, who are the individuals that are going in there? What was the cost of their existing care arrangement, wherever that might be, versus what is the cost in that far side development, but also linking it back to the quality and the kind of outcomes for people as well. So that financial aspect, and I think it forms part of our, Mike's we're kind of jumping ahead, but that kind of development session and the future options, it's that type of thing that we're looking at as well, in terms of right for people, good for the residents, but also has financial benefits potentially as well.
Thank you.
Thanks, David. Thanks, Shamim. Jonathan?
Yeah, thanks, Andrew. For Mike, I guess I'm just sort of wondering if this is a good time to reflect upon the planning process for 26-27, given that the government budget is going to be delayed by more than a month this year to middle of January, and certainly I don't know what the experience was on the social care on the council side in terms of 25-26, but certainly on the health side, the whole planning process even last year, despite it being a month earlier, was not optimal, and we're pushing at a board level for planning to be done earlier to make sure that when we get to the 1st of April, you know, we sort of hit the ground running. And given that, you know, we're still forecasting, you know, 5 million plus deficits going into next year, you know, I'm just a bit concerned in terms of, you know, what the timing is of the role of this board to really sort of look at the bigger decisions, if any, that we need to make for next year, and do it early enough and plan early enough. If we're not getting a budget until middle of January, suddenly IJB is not even looking at anything until March, April, May, August, blah, blah, blah. And with this time next year, before we're even really looking at next year's budget, and I'm being a little bit facetious, but it does concern me, and especially, and my final point being, of course, we're heading into political uncertainty with the elections next year, which will cause issues, we know, at a national level. So I'm just don't know if this is the time or not, Andrew, but I just open that one up there so we are clear. I know there is timing set down for stuff, and I can't remember what it is, but I'll just raise that question.
In advance of Mike's saying, we had a planning call at lunchtime around exactly this and how we try and feed that into. And the fallback is always we push it to another conversation, but all of these issues we need to try and flush out at our next development session, which is the end of November. We have one known fact at this point in time, is that we have a £5-point-something million gap. I don't think that may change slightly, but we still have. So we do have some certainty as to what the gap is, and we need to see what the schemes that are going to come forward from colleagues will be to address that. But that's only 1 year of a 5-year medium-term forecast. So the questions you asked, we asked ourselves at lunchtime, and Mike will be presenting, and Fiona and colleagues, the work that they're on with to IJB members at that development session. That doesn't answer the question now, John, but we had exactly the same. And all of those things around timings, I think it worries us all. But
yeah,
let's deal with the things that we know. We know we have a £5 million gap. And that doesn't go away. So, Mike, sorry, I've stole all the thunder there, probably.
No, but I think that's the point, Andrew. You're absolutely right. We do actually know, clearly there are uncertainties, but you absolutely described it well. We actually know 99% of this. Yes, there'll be a bit of uncertainty in terms of exact numbers, but if we're making bigger decisions, we know that now if we're doing it or not. And I think we need time to just gestate and think and plan through that. I just want assurance that we're not going to be sitting here in March, April, May next year talking about the budget. That's all. I guess it's assurance I'm looking for.
I will let Mike and Fiona give you answer to that. Mike.
It's a fair comment, Jonathan, and I mean, as Andrew said quite eloquently, that we have talked about this on and off, and more so today. We've got 4 IJBs and we've got 2 development sessions between now and the 31st of March. The council were obliged to take their financial plan for approval in a certain date in February. So we know we will have some assurance around that from the council. The health board is saying they will have to have an agreed position going into the next financial year, and we are required to set a balanced budget at the end of March. So we have all that in our knowledge and in our sort of planning process. And as Andrew said, we've got opportunities over the next couple of development sessions to, first of all, bring the IJB up to speed of where we are with all of this and what the themes are and the main issues that we're identifying. And then we will have a much more detailed understanding at the second development day about the decisions that we need to make and trying to make those decisions within the time scale. So the planning process is there. And as Andrew said, the numbers may change slightly, but there's still a significant gap that we know that we're going to have to close. So we're still working on that basis.
Okay, and just obviously, Shameen would normally probably ask such a question. Maybe as long as again, I just want to be, and hopefully we will do this on a system-wide basis. I'm not quite sure if I can choose the right words. Where we're looking at council and health together. Let's try not to do this separately. We're meant to be working as a team. So I just put that ask out there again. That we're actually, trying to look at it as a whole system and don't just come at it as 2 pieces and which you just add together at the end.
Fiona, I'm sure you'll comment on that as well. Sorry, Mike.
Yeah, so definitely looking at it as a whole system and working with partners, what we hope to bring at the development session. And I think, Jonathan, you were around before we did it like this, just I suppose starting that already we are engaging even through here, but actually this is where we're at. And I know the amount of work that's going on by GMs and the range of work and the collaboration that's gone beyond boundaries than it had before, that I'm hoping we can present around where we are hoping to make savings, where we're hoping to make investment, where we can make savings longer term. So it's not just this year, it's multi-year around how we're doing it. So David and I had a first look at it this morning, even though GMs have been working really, really hard on it, and it shows promise. And even that there's challenge with that. So that's what we're hoping to do in November at that development session in a similar way that we've done it before, so that there's not the surprises of making a decision at that point. We're taking IJB members with us and broadening the context. So I hope that helps, Jonathan.
Yeah, thank you.
Laura?
Yeah, and thanks for letting me come in as one of those GMs. I think the biggest challenge that we're challenging ourselves with is that joined up approach. So it's much easier just to do it in your own service area. I'll take that, I'll reduce that. What our challenge is and what we're trying to rise to is that ability to do that system-wide change you were meeting, Jonathan, and I suppose the constant struggle is actually that's not always going to deliver in year that we need it, what it needs to do financially, and it's how do we therefore, okay, well, we know it'll deliver financially in 3-4 years time, so what do we do in the meantime to support that system-wide change? And it is such a challenge for us, but we are a close GM group and we strive to not work in those silos of services.
Thanks, Laura. Shameen?
Yeah, just to kind of reflect on what people are saying. Just last week there was a meeting of COSLA, the Health and Social Care Board, and one of the chief finance officers came along to represent all the other local authority chief finance officers, and what they were all saying is health and social care is on top of the list of pressures and that require to be looked at, and also what our understanding is that it'll be a 3-year settlement. So whilst it'll be difficult, of course, for this year, hopefully, if that is the case and that does materialise, it does give some kind of stability to the system of what's coming through. But definitely one of the things I shared was the pressures and finances and difficulties that are shared by both partners at East Lothian IJB.
Thank you, Shameen. I'm seeing no further hands. This paper is to note. I think we've had a good conversation around this, and thanks for the technical update, Mike, and we look forward to further conversations around this. We are going to be a few minutes early in closing. We have an agenda item 8, which is just for information, which is a link to the audit and risk committee papers. And I'll draw the meeting to a conclusion to say that we have, I'll bring you in a sec, Fiona, two further meetings in this calendar year with the development session on the 27th of December, which will be in person, and the next formal IJB meeting is on the 18th of December. Fiona Curry, please.
It was just to say that with the Audit and Risk Committee, they weren't able to appoint a chair at their last meeting, but that will be done at their next meeting on the 2nd of December.
Brilliant. Thank you, Fiona. I have no other business. I see no other hands. Thank you, colleagues. As I said at the beginning, if any of the talent management colleagues wish to come back and ask any further questions, myself and colleagues will be more than happy to address this. Thank you, everyone. You have 13 minutes extra in your day. Take care, everyone.
Great. Thanks, Andrew. Thanks, everybody.
Thanks, Andrew. Thank you.